Hello, everybody. Thank you for attending our webinar this afternoon entitled Mental Health, Migraine, Workplace Culture in Times of COVID-19. This is in collaboration with PATHw, or Progressive Alliance Towards Healthy Workplaces, Novartis Healthcare Philippines, and Great Place to Work. My name is Gladys Santiago-Zafra, consultant of Great Place to Work, and I will be your moderator. We are very honored and privileged to have two beautiful ladies from the medical field who will share their insights. Dr. Gia Grace Sison of the Philippine College of Occupational Medicine will talk about caring for employee health in the face of COVID-19. Dr. Martha Lu-Bolaños of the Philippine Neurological Association shall discuss migraine in the workplace and how to help the employees. The webinar will be closed by Miss Christine Fajardo, Corporate Affairs Head of Novartis Healthcare Philippines, wherein the call and action for all of us will be a fruitful partnership for a healthier workplace. Opening the doors to talk about great workplace and being better together in times like this that is related to mental health and wellness and will lead to migraine in the work environment. Ms. Antoniette Talosig shall enlighten all of us of the definition of a great workplace. So sharing with you the objectives of today's webinar, we aim to provide relevant education and platform for experience sharing about managing employee mental health during pandemic and to highlight the burden of migraine and value migraine prevention to company stakeholders. Providing more light about our collaboration, Progressive Alliance Towards Healthy Workplaces, or PATHw, is a pan-Asian coalition of HR and business leaders that was founded in 2019 when Novartis joined forces with a global multi-stakeholder organization partnership to fight chronic disease, or PFCD, leading international provider of telemedicine, Medgate, Singapore-based healthcare communications firm SPAG, and the Swiss Embassy in the Philippines. This coalition aims to develop a comprehensive and long-term action plan to reduce the burden of non-communicable diseases, or NCDs, including migraine in the workplace. As a part of this initiative, PATHw has launched series of webinars, PATHw Perspectives, to generate awareness about various issues. Great Place to Work supports the movement towards a healthy workplace. With that, let us have an engaging discussion. There is a Q&A or chat box below your screen, so type away all your questions, which will be addressed later on during the open forum. So with that, we all want to be part of a great workplace. What does a great workplace really mean? How do we create one for ourselves and for our employees? And is it even possible to create a great workplace during a global crisis? So these are the questions that Tony Talosig, the managing partner of Great Place to Work Philippines, will answer for us. So sharing about Tony, who has brought Great Place to Work in the Philippines, the global authority in workplace culture, with the social mission of creating great workplace for the Filipino employees. She has close to 2 decades of experience in culture transformation, employee engagement, employer branding, leadership development, strengthened by her close partnership with the Singapore government agencies, SMEs, multinational corporations, and some Fortune 100 companies across industries and geographies. So, ladies and gentlemen, Ms. Tony Talosig.
Thank you, Gladys.
You're welcome.
I'll be sharing my screen. Gladys, can you confirm if you're seeing it right now?
Yes, I am seeing it right now.
Okay, thank you. Thank you so much.
welcome.
Yeah, so good afternoon, everyone. It's an honor for us to be here. As Gladys has mentioned, we hope that this will be an interactive session for all. But very brief introduction. So Great Place to Work. We are a global authority in workplace culture. We started here in the Philippines a year ago, and we are really very excited to find out that there are a number of organizations who are really ready to create that great workplace for the Filipino community. Our mission, and we really take this seriously, is to help build a better world by helping organizations become great places to work for all. But what does it really mean? Like, if our mission is to be a great workplace for all, what is a great workplace? So we do have over 30 years of research, and year after year, we would revisit the definition of a great workplace to see whether it still applies, especially right now during the pandemic. But again and again, we find that a great workplace is one wherein that is founded in trust. It is defined by employees as one wherein they trust the people that they work for, they have pride in the work that they do, and they enjoy the people that they work with. So I know that we are all coming from different organizations right now, but think of yourself as an employee of that organization, like employee of Great Place to Work, myself, employee of Novartis, or wherever you are from. You actually have 3 key relationships within your organization. And those are your relationship with management, your boss, and the senior leaders, your relationship with the other employees, your colleagues or your peers, and the relationship that you have with your job. So a great workplace is one that is anchored in trust across all these 3 key relationships. When we talk about relationship with management, we're looking into aspects of credibility, respect, and fairness. And when we talk about healthy relationship amongst employees, what we're trying to find out is there strong camaraderie amongst colleagues? And then your relationship with your job is reflected by the sense of pride that you have. Like when you go back home, do you talk positive things about the organization or the work that you do to your family and your friends? So these are what we call the 5 dimensions of a great workplace: credibility, respect, fairness, pride, and camaraderie. Credibility is about the quality of communication that you have with your employees. It is whether your employees see management as credible, like do they trust your judgment when it comes to business or hiring, or do they see you as a competent leader in the organization? Then there's that aspect of respect. Do your employees feel that they are respected as an individual, not just as an employee? Fairness, we all know this is around perceptions around pay, equality, or justice, that regardless of my gender, regardless of my age, my religion, I feel that I'm treated equally within the organization. Pride, on the other hand, as I've mentioned, it's the sense of pride. Like I am proud of our contribution to the community and my contribution to the organization itself. And then relationship with my colleagues, wherein we're able to have that family or team spirit. All of these are important in building that great workplace. However, during this pandemic, during these times that we are at, we find that one dimension stands out. It tends to stand out amongst all of the other 5 dimensions, and that is respect. When we talk about respect, it is about employees feeling that they are supported, that there is collaboration between them and management, there's open communication, and that they feel that they are cared for. So why is this important during this time? There are various reasons, and we all see this day after day since COVID-19 began. It is because employees tend to work longer hours now. Research shows that on average, employees work 2 hours more than usual. There's also a spike in the use of VPN from midnight to 3 a.m. Employees are feeling burnt out. And there's that what we call heightened everyday fear, like employees feeling anxious on how they can reconcile work responsibilities and their personal responsibilities. Like if you have your kids at home with you doing home schooling, how do I balance all this? And of course, with lack of trust in the organization, employees feel the pressure to prove to their bosses that they're actually doing their work. So ultimately, employees feel that there's no escape. Without nothing much to do, there's no escape for them, nowhere else to go, there's no escape for them for being unavailable. Then how do we create a culture, a caring culture for the organization? So our research shows that there are many factors to create this, but what really stands out during this time is that as leaders, we need to be approachable. We need to make ourselves available for our employees, talk to them even more frequently. They need to feel that we are genuinely interested in them as a person and not just as an employee. to encourage them to take time off and not just having those leave credits for them to do that, but really encouraging them, talking to them about family, and creating that psychological and emotional healthy workplace for your people, regardless whether it is from home or once we go back to the workplace. So bottom line, really, what we are finding out is that creating a caring workplace culture that is emotionally and physically safe is very important, but all the more so now during a crisis. Later on, we'll be sharing some of the case studies that we have from some of the great workplaces here in the Philippines. But with that, yeah, I'll give it back to Gladys. Gladys, I think you're on mute.
Thank you, thank you, thank you so much. Apologies about that. So anyway, thank you so much, Tony, for this. I think the key takeaway of a great and caring workplace is that we ask ourselves, how relevant is the situation? COVID-19 affected the business environment and its workforce. From here, leaders have to be mindful of the workforce mental and physical well-being, which is not a new concept, and that has been the focus area of many organizations even before the pandemic. The reason for this are significant. Organizations have realized that the human capital is the biggest asset. If gone wrong, it can nullify the best strategies and business plans. They also realize the investments in human capital have way higher returns than expected, as a happy and healthy workforce is also highly effective, efficient, and creative. The current evolution of business operations and work from home setups, which Tony cited earlier, has led employees to struggle with balancing their health and work. Organizations have a huge role to play towards their employees in this time of crisis. The first step is to realize the problem today, in which Dr. Gia Sison will talk about how organizations can play a role in, number one, keeping their employees physically and mentally safe, and number two, supporting their employees who are working from home. So sharing about Doc Gia, she has 20 years of experience in occupational medicine. She currently heads the Women's Wellness Center in Makati Medical Center. Dr. Gia Sison is also the National Advisor for the Philippines Youth for Mental Health Coalition and the host of G-Talks, a digital series on CNN Philippines. She was previously a consultant at the World Health Organization. Ladies and gentlemen, Dr. Gia Sison.
Hello, everyone. Good afternoon, and thank you for the invite in today's webinar. So this afternoon, I'll be discussing about caring for employee mental health in the face of COVID-19. So next slide. So just like the stages of grief, based on a study of SAMHSA, there are also phases of disaster. So when you look at the graph, we are technically on the disillusionment part, because based on this study done last 2000, it takes an average of 1 year before we can start all over again, before we can start to reconstruct, new beginning, and to work through grief. Next slide. And on this slide, here are the most common mental health concerns in the time of COVID. Very evident is the uncertainty about the future, because even the most stable jobs have crumbled down, and we aren't even sure what's going to happen after June 30. Some of us have actually lost a loved one, and we have to adjust to the changes. And up until now, there are expected heightened emotions would still happen, since it's an ongoing pandemic. Next slide, please. So aside from COVID is here. The other side of the spectrum is the additional threat of isolation and loneliness. Thus, in the workplace, it's very important that both employers and employees have this sense of safe space feeling, where they are able to still work and function effectively despite the pandemic. Next slide. So some of you, I'm sure most of you are on the work from home setup. This slide just says that if we don't watch out for the determining factors, which is on your lower left, it may eventually lead to burnout. So self-awareness is key. So stay attuned to how you feel. Are you anxious? Are you overwhelmed with what you're doing? Acceptance of the situation is another thing. Please don't forget about physical wellness, the way you eat, sleep, um, physical exercise. These are the pillars of health because we want to stay healthy. And of course, the most important part is we are able to establish boundaries. So it doesn't mean that we are work from home, we are 24/7 on call. So, and pace yourself. So on this part, I think it's very important to be able to establish a daily routine that you follow, that at least we don't get overwhelmed with what's happening. Next slide. So this is the definition of health. So health isn't all about physical health. There is a psychological component and there's a social component. So marry these all together. That's a definition of health. Next slide. So we go on to the tips on caring for the mental health of employees. Next slide. Okay, so number one, it's very important that the employers and of course within your team, you're able to communicate the risk and plans clearly. Remember on the first part of my talk, uncertainty is always present. So let's beat that with something that may not be so, at least communication should be established and plans should be made clear to everyone when to report to work, who reports physically on site, who can do it off site. So that's called strategic planning too. So next slide. So there has to be a clear return to work protocol. Of course, we want to ensure that it's a safe space to come back to. So again, communication is key, and then ensure that everyone is involved, no one is left behind. Next slide. And based on a study done last 2020, employees who say their manager is not good at communicating are 23% more likely to experience mental health declines. So it's so important that your manager touches base with you every now and then. Team huddles are very important. Regular, consistent communication is key in being able to manage the seemingly overwhelming things that have been happening since COVID hit us. Next slide. Number two, similar to communication, also inform your employees of the possible mental health effects of the pandemic. Being overwhelmed is expected, being uncertain is expected, and opening avenues for conversations about this in the workplace actually gives your employees a sense of security that I'm going home to. So it means that you care about how they are, not only physically but emotionally as well. Next slide. And this is very important. Although we're not expecting everyone to be able to at least to diagnose. Of course, that's the job of the doctors, the psychologists, but to recognize the early signs of mental health distress is equally important. So on the next slide, these are the common, I divided it into 3 columns because there may be a physical manifestation, there's a psychological manifestation, and behavioral. Most of the time in my practice, although I'm not a psychiatrist, I oftentimes experience change in behavior as a very common first manifestation of possible distress. So when an employee is usually the happy type or the quiet type that seems to be isolated more, then that may be one of the signs of loss of motivation as well. So you just go through this. I won't go through them one by one. Next slide. And you also have to, in communication planning, you have to also map out possible triggers in the workplace. because oftentimes when you look at mental health, it is something that is complex. It's not just, it's dynamic, it changes, it's complex, and it's a combination of our internal struggles and what's happening externally. So this list are actually workplace triggers. So again, I won't go through them, but the most common here are high pressure environments, including demanding deadlines or unrealistic deadlines, so to speak. Long hours, no breaks, of course, job insecurities, there's role ambiguity, you don't know what to do. So I think during these times of the pandemic, we have to be really clear in terms of communicating what we expect from our employees. Next slide. Very important, check up on your employees. The word "how are you" is very powerful. So again, not only physically, check on them from time to time. Next slide. So here are some examples on how you can check on them. You may want to have informal conversations. Some have mood meters, make use of technology where they actually just enter their mood per day. There are apps for that. And surveys may help. Regular team huddles like weekly huddles through Zoom and other platforms. And of course, monitoring them, yes, that's part of it, but it shouldn't really be heavily reliant on it because, again, it should be output-based. Okay, so next slide. And these are actually questions that you may ask. On your left, these are questions to ask, and to your right are questions to avoid. Typical example is, you're clearly struggling. What's up? So when you ask that, it may trigger your employee to say, or if your employee is prone to depression, it may trigger it more. It may question his or her self-worth more. So instead of asking that, you may want to ask that powerful 3 question, like, how are you doing at the moment? So the questions on your left are actually encouraging questions, engaging questions, where your employees or even the managers would feel that they belong and they're cared for. Next slide. And of course, in disclosure, when someone opens up to you, don't assume, don't judge, encourage more talk, and respond accordingly. Some don't even want advice. Some just want someone to listen to. Next slide. Remember, disclosure starts from the top. So being vulnerable really actually improves team performance. So this slide is just saying that it starts from the leaders. So leaders aren't supposed to be always strong. In fact, all the more the leader should show their employees that they're human too. So with that, it creates more bonding, more sense of, my boss is this way, I should be this way, something like that. Be a role model. And again, being vulnerable is actually a power. Next slide. Of course, make support services available too. So have a list of your referral networks where you can refer your employee if and when you see that he or she is showing signs of possible mental health distress. Next slide. And here are some mental health services that you may want to have in your office, like employee-led support groups really works because they feel that they're inclusive. They talk regularly. And of course, on the other side, don't forget the physical aspect, employee assistance programs help, and the like. Next slide. And this is from the World Health Organization. I just want to emphasize that on the bottom of the pyramid, which is the foundation of everything, there's a great emphasis on self-care. So it starts from within, intrinsic, then it goes out extrinsically. So before you take care of others, you just need to ensure that you take care of yourself first. Next slide. When do we refer? If the employee is a danger to herself, himself, and a danger to others, then refer. Deviance from the normal behavior, dysfunction, distress. So if it's already affecting the quality of one's life, then maybe it's time to refer. And don't forget, self-diagnosing may delay appropriate management. So the earlier it gets caught, the better. Next slide. And this is just the difference between psychiatrists and psychologists, just to give you a picture. They both are experts in mental health, and they both conduct psychotherapy. Psychiatrists they're medical doctors, and they're the ones that really usually prescribe treatments. But in the world of mental health, in the advocacy of mental health and healthcare as a whole, I think everyone should be involved. A more holistic team, the better. Next slide. And don't forget to recalibrate goals and set reasonable accommodations. Next slide. So when you say reasonable accommodations, it's making it more flexible. It's adjusting, especially nowadays when COVID is still around and it's going to stay for quite some time. I think having flexible accommodations can be the best thing that you can do also for your employees. Next slide. What accommodation is not providing opportunities to those who can't do what is necessary, and it doesn't also mean lowering standards. So just to be clear on the definition of reasonable accommodation. Next slide. And these are steps on how you can determine reasonable accommodation and how flexible you should be. Example, you need to assess the worker's abilities to be able to, example, work from home. So again, the whole summary of this slide is, I think it's about time that we shift to being output-based rather than physically present but can't function. So always recalibrate your goals to what the worker's skills and abilities are and leverage on it. Next slide. And these are just possible areas, the ones on your left. These are possible areas where you want to flex your accommodation in terms of job performance, in terms of role, and extra support. So just read on it. So I have already mentioned some of these points during my talk earlier. Next slide. And this is an algorithm for those who are underperforming. So when you look at this algorithm, it's not an immediate issue of termination. It's really all about more communication, providing reasonable accommodation, and regular performance evaluations. And as much as possible, encourage support if needed. So next slide. And of course, gradual return to work. You don't just make them go back to work and it's back to normal. You have to allow the employee to begin with tasks that they agree that they will be able to accomplish. So do not overwhelm the workforce so much, because we are already overwhelmed by COVID in itself. I think it's another thing if we start to manage expectations in terms of workload. Next slide. Again, flexible scheduling. Again, the mental health, physical health matters, and minimizing as much the stressors as well. Next slide. And before I end, don't forget about creating a community of care. So in mental health, it's not only about self. We also emphasize the importance of structural and social rearrangements that need to be done alongside the usual support that we give. So creating a community of care is actually creating a safe space for everyone. Next slide. And remember, social distancing doesn't mean social isolation. What we recommend is only physical distancing, but it doesn't mean that we totally cut off ourselves from society. So next slide. So that ends my talk. Thank you very much and good afternoon.
Thank you so much, Doc Gia, for the rich information that you shared about mental health in the workplace. As a key takeaway from Doc Gia's session or talk, with the uncertainties that is going on, communication is a strong avenue for the organization to show your care to your people. I remember from the roundtable session that was organized by PATHw and Novartis Healthcare Philippines back in November 2019. High-pressure situations, especially at this point, may lead to mental and physical challenges. Being so, migraine is a neurological condition that causes several symptoms, including pain, which may lead to lowered productivity. It is among the top 10 most disabling disorders worldwide. This disease affects not only the physiological domain, but also mental and emotional health domains. People with chronic migraine often experience depression or anxiety orders. It is not uncommon for people with chronic migraine to struggle with lost productivity. Some of this is due to mood disorders like depression, which may accompany migraines. So for today, Dr. Martha Lu-Bolaños will talk about the burden of migraine in terms of humanistic and economic impact to productivity. Also, we will discuss the possible interventions that HR leaders present today can implement in the workplace. Sharing about Doc Martha, who is currently the adult and pediatric neurologist at the Philippine General Hospital, she heads the Child Neurology OPD at Philippine Children's Medical Center, the EEG and Epilepsy Unit, Center for Neurodiagnostic and Therapeutic Services, Metropolitan Medical Center, and the Headache Council Philippine Neurological Association. Dr. Lu-Bolaños is a clinical associate professor at the section of pediatric neurology in the Philippine General Hospital and the treasurer at the Philippine Headache Society. Ladies and gentlemen, Dr. Martha Lu-Bolaños.
Hi, good afternoon.
Good
I'll share my
afternoon.
slide. Okay. Can you view my slide, Gladys?
Yes, I can view it. Very
Okay, thank
clear.
you.
You're welcome.
Thank you for the introduction, and thank you to Dr. Gia Sison for a very timely lecture. So I hope migraine is still applicable in our setting. We would like to discuss migraine today because it's a big burden, not only for employees, but also for employers as well. Okay. So for this afternoon, we would be talking about what is migraine and when does it happen? Are there any triggers? And what would be the burden of this, especially in the workforce? And how can we diagnose and manage migraine? So migraine is a very common topic that you can see in many health magazines. What is migraine? It is a clinically disabling primary headache, meaning it has no underlying cause. There is no physical or structural problem in the brain which causes the headache, but it's a primary headache which is recurrent and disabling. Internationally or globally, it affects more than 10% of the population, and it is more common in women than in men. And most of the primary headaches, like migraine and tension type headache, are more common in women. It is also associated with substantial personal, family, and economic burden. So how does migraine present? So it is a recurrent headache, usually unilateral, but sometimes it can be bilateral or generalized headache, and it is moderate to severe in intensity, and usually the patients would complain of a throbbing pain or a pulsating pain. It is usually associated with nausea and vomiting, and patients may experience visual disturbances like scotomas, and they are very sensitive to light and sound, which could trigger or exacerbate their migraine. There are also certain environmental factors associated with migraine, which I will be discussing later on. There are also studies which show that migraine has a genetic influence, specifically hemiplegic migraine. But there's also a strong family history of migraine, wherein no specific gene has yet been localized. So for easier diagnosis of migraine, usually we would rely on the International Classification of Headache Disorders. So if you have a headache which lasts for a minimum of 4 hours, not the headache which lasts for 30 minutes or 1 hour. Migraine would usually last for many hours, from 4 hours to even more than a day. And then you have the characteristic unilateral throbbing, moderate to severe intensity, and worsened by activity, such that the patient's migraine or headache can be exacerbated when the patient has to do certain chores, and associated with nausea and or vomiting, and photophobia or sensitivity to light, and phonophobia or sensitivity to sound. So any two of the characteristics on the left side plus any one characteristic on the right side would already tell you that this patient has migraine. Now, how do we differentiate migraine from other types of primary headache? The most common type of primary headache is actually tension type headache, but it is milder in intensity, and then usually it is pressing in quality, such that the patient would complain of a band-like sensation on his head, and then usually it would last for fewer minutes, like 30 minutes or even a week. Patient may complain of daily headaches, and if you touch the temples or the frontal muscles of the patient may complain of pain or tenderness, and they may also have photophobia or phonophobia, but not as common as in migraine headache. And the patient can still work even if the patient are having tension headaches. The cluster headache is a type of primary headache which is common in men. One of the few headaches which is common in men. It is also severe in intensity, but it lasts for only a few minutes, like 15 to 180 minutes at the most. It is located around the eye or behind the eye or at the temple area, and it can occur many times in a day in clusters. It is also associated with drooping of that particular eye where the pain is located, and there may be associated tearing or nasal congestion or rhinorrhea or nasal dripping and facial sweating. So a migraine attack can actually have 4 phases. Sorry. Okay. Usually it would start with a prodrome. This may occur a day or a few days prior to the actual migraine attack, and this would be characterized by certain food cravings or muscle pain or fatigability. And then on the day of the migraine, patient may complain of aura. This is the classical migraine or migraine with aura, wherein patient may have changes in vision like scotomata, or the patient may complain of seeing bright lights or zigzag lines just prior to the headache, or they may have problems in speech, or they may have skin sensations like numbness or tingling sensations of 1 or 2 extremities. And then within an hour, the headache would start. Okay? Sometimes the aura can be mistaken for transient ischemic attacks or strokes which are about to happen, but difference of this is the aura symptoms would last for less than an hour, unlike in strokes wherein the symptoms would be persistent. So the headache that follows is usually the characteristic unilateral throbbing headache, which is moderate to severe in intensity, and it may last for a day or 3. And after which you can have the prodrome, wherein patients again may have easy fatigability, lack of concentration, muscle pain, especially in the neck area. Patients may still be irritable, and patients may have another food craving. So at the minimum, the migraine can last for 3 days from the prodrome to the postdrome, or even longer, depending on the duration of the headache. So this is very disabling to the patient. So migraine is very disabling, and it can affect not only the head area, but usually also the neck and the upper shoulders area, and it can be triggered by certain factors. So here we see that it can be triggered by photic stimulation like bright lights, especially when the people or the person is facing the monitor, the computer monitor the whole day. This can be a trigger. So we advise anti-glare shields or glasses. Or if the environment is very noisy, this can also trigger their migraine, and certain foods, which I will be mentioning later. So how can we help people with migraine? Okay? In a study by the American Migraine Prevalence and Prevention, we see that more than 50% of patients with migraine can have severe impairment, and they can only be relieved with bed rest. So this is very difficult when the patient is in the workplace, and only around 7% can still function even during the migraine attack. During a migraine, a person is unable to work or function normally, and approximately more than 50% are severely impaired and cannot work. So this would affect not only their activities at home, but also in work and in school. So family activities and social relationships, and the most important would be their work output, is very much affected. They spend less time with their spouses. When they go home, they cannot even teach their children their assignments because they are already debilitated with their migraine attacks. So how do we help our patients, especially because some of them feel that they are stigmatized? Okay? There is actually no objective measure of pain, as you know, not only for migraine, but even for other types of pain. So usually these patients can be stigmatized, or they are judged for having these attacks as being OA. So non-migraine sufferers usually underestimate the pain episodes of our patients, and this would lead to inability to work. Thus, the burden of their work is transferred to the other employees, which may cause problems within the workforce. 58% of people living with migraine are in full or part-time paid employment. More than 90% of individuals report they cannot work or function normally with their migraine, and people with migraine report a decrease of almost 50% in their productivity during a migraine, thus causing presenteeism. Patients may be in the workforce, they may be present in the office, but actually they cannot work and their productivity is greatly compromised. In this comparison among the burden of migraine compared with the other illnesses, you see that the highest is among patients with migraine from 70 to 90%. And in this graph, comparing the annual cost of migraine in Europe, you can see that on the average, you have 1,000 euro per patient for the indirect and direct annual costs. The indirect costs would include reduced productivity at work and absenteeism from work, and the direct costs would include outpatient healthcare, prophylactic, as well as acute medications, diagnostic investigations, as well as hospitalizations. So this is really a big burden for the employer as well. So we can see that migraine has a significant impact on the quality of life of a person, not only at home, but also in his work. And patients are greatly stigmatized, and there is not only a social, but also economic burden for these patients, leading to a lost productivity. So when the patient comes in, we establish first the diagnosis of migraine. We educate them regarding their condition, And we tell them that there is actually no cure for migraine, but we have acute medications as well as preventive medications so that their migraine attacks can be lesser in frequency. We give them a formal management plan, individualize the treatment, and encourage the patients to identify their trigger factors. So there are a lot of non-pharmacologic strategies that the patient can do to prevent migraine attacks. Patient should have regular meals, a well-balanced diet, and he should know what are her migraine triggers. This is different among the patients, so they have to have a migraine diary so that they could identify if there is any food or trigger for their migraine. So some patients are sensitive to chocolate, some are sensitive to aged cheese, and a lot of patients have migraine attacks with monosodium glutamate, so that we have the Chinese restaurant syndrome because of the increased MSG in the dishes. These patients would have migraine after their meals, and we also advise them to restrict their alcohol consumption and smoking cessation. They should maintain regular sleeping patterns and enjoy some relaxation techniques, like stress management or CBT or biofeedback, and to avoid their migraine triggers and stressful situations if possible. We have this app called Migraine Buddy, wherein patient can actually have this as their headache diary. I have a patient recently who showed me his Migraine Buddy app, and the results was very good because it can show me all the headache days per month, the frequency, the intensity of each headache attack, and if there were any triggers that were identified for each attack. And we also have the MIDAS, or the Migraine Disability Assessment, in this app so that the patient can say how disabled was he during the migraine attack. And it could vary from one attack to the other. So migraine can also be controlled or prevented with these medications. We give acute treatment for the attacks, and usually we have to give the acute medications during the start of the headache, not during the peak of the headache, because at that time the headache would be difficult to control. But of course, we don't want also the patients to abuse these medications because they might develop medication overuse headache. And when the attacks are very frequent, like more than once a week or more than 4 times per month, we prescribe prophylactic medications or preventive medications. So these medications are taken orally daily to prevent the frequency and the intensity of the attacks. And lately, we have the injectables, the monoclonal antibodies, which can also prevent attacks, and it is only given once a month. Especially for patients who do not want to take medications daily, this is very helpful. So what we want to emphasize is that employers can raise migraine awareness in the workplace and identify these patients who might need professional help, because some of these patients do not want to absent themselves, so they just control their headache attacks with acute medications, which they may overuse at times. And probably we can also empower the employees to seek better care through internet materials and to know more about their illness. We can support our colleagues, our employees, and our employers. We can be sensitive to the needs of our employees who have migraine. Probably we can also enroll the company doctor to CME activities for migraine. We can also provide a more conducive atmosphere for the employees. And then we have to reduce the triggers, like light triggers, extended use of the computers. We make give them anti-glare materials, and reduce also noise triggers in the workforce. Probably for the fragrance that we use in the office, we want to use those which are less irritative, and allow flexibility schedule for our employees, especially now since most of you I know are working at home, but the closest that we get into contact are the medical representatives, and they would also tell us that even if they're working at home, they feel also that they are overworked sometimes because of the many Zoom activities. So sometimes they're working more than 8 hours per day, more than what they were working regularly before the pandemic. So we can also provide flexibility in the workplace. And we would also like to introduce this Facebook page, which is Speak Your Migraine. So patients can log in and they can share their experiences with other patients. There's actually a moderator here from Novartis who sometimes advise them. And if they would need professional help, then they are advised to seek a neurologist for the management of their migraine. So for prevention, it is very important that you have a good diet, enough exercise, a good round of sleep, and of course, relaxation techniques. Thank you very much.
Thank you so much, Doc Martha, for your insightful talk about migraine and also for breaking down the types of migraine that are encountered by so many people. So at this point, we have learned the importance of caring for our employees by supporting their mental and physical well-being. We also gained some insights on what we can do as leaders and HR practitioners to create a caring culture in our organization. More so, we now know the relevance of migraine in the new normal, especially most of us are still working from home. This can be a jumpstart for all of us to create and strengthen communication planning regarding migraine and, of course, mental health. As we will have our open forum later, let us hear some case studies on how great workplaces in the Philippines care for their employees amidst this pandemic. So with that, let's welcome back Tony. Tony, take it away.
Thanks, Gladys. Thanks also, Doc Gia and Doc Martha. I learned a lot from that, suffering from migraine myself. But yeah, I think what mental health and migraine are really issues that we are facing anywhere in the world, and in despite of like regardless in which workplace you work. And I see it as an opportunity for us to create that caring culture for our employees. And there are some best workplaces in the Philippines and certified companies in the Philippines who really paved the way and went the extra mile to create that kind of caring culture for their employees even before COVID happened, but more so now that during the pandemic. So I'd like to share 3 case studies from this great workplaces in the Philippines. So one is 3M. So we all know 3M, right? Like from Post-it to now using the mask made by 3M. 3M actually has their customer service located in Taguig at BGC. And there are a lot of things, a lot of initiatives that they're doing to look after their employees during this pandemic. And as Dr. Gia mentioned earlier, it really starts with awareness, helping their employees to know more about what is this pandemic all about and how will this impact their health. So 3M went the extra mile, even invited doctors, shared resources to their employees so that they would create that level of awareness. They also created that physical, safe environment for the employees. And this was right at the onset of COVID, before ECQ doing their regular rounds of cleaning. And another thing, the third point that they did is that they also recognized that relationship is vital in employees' well-being. So I remember seeing that diagram earlier, like social well-being is very important as part of our overall health and wellness. So 3M introduced some activities like quick TV sessions with their employees and also free counseling sessions for their psychological health. Another organization is SNP Global Philippines. So they are the world's foremost provider of credit ratings, benchmarks, and analytics. And they do have close to 1,000 employees in the Philippines. So 3M is also a great place to work certified companies. They focused a lot in supporting their employees' health and wellness. They provided teledoctor, they gave additional sick leave, and also paid care leave. So what's unique about SNP Global is that they didn't only look after their employees' welfare, but also the employees' dependents. So their employee assistance program, which is 24 hours, also covers mental health and emotional support for employees as well as their dependents. Last case study I want to share is Ingram Micro. So Ingram Micro is one of the best workplaces in the Philippines, which we announced during our inaugural event, virtual event last May. So they are one of the world's key player in technology and supply chain. And just at the onset of COVID-19, Ingram Micro received their Great Place to Work certification badge. And they also launched their employer branding campaign, which is called Step into Greatness. So they believe that greatness is not a destination, but it's actually a journey which all of their employees are part of. So what they've been doing is that they're really genuinely caring for their employees. Again, starting off with awareness, having wellness at home campaign, virtual sessions on mental health, having employee assistance program. And one thing that we can learn from them is how they created various platforms to encourage continuous camaraderie in a fun and creative way. So again, that kind of interaction. So there's no stopping the fun and camaraderie that they have in their organization, not even a pandemic. They create a lot of virtual activities like online dance and music clubs, TikTok challenges, even having virtual quiz bees, just to engage their employees and make sure that they are able to have that social interaction. As Doc Gia mentioned earlier, we are practicing physical distance, but not social distance. And Ingram Micro is doing a lot of this for their employees. I would also want to encourage all of the participants, do visit the website. You will see more case studies from great workplaces that you can learn from. And as we've mentioned, and all of the speakers mentioned, communicating with your employees is very important. It's very crucial at this point in time. You can also avail of a free employee pulse survey as another means for you to hear your employees. Yeah, so with that, thank you.
Thank you so much, Tony, for all the case studies that have been presented earlier. So while we are waiting for questions for our open forum, we would like to take this opportunity to acknowledge the presence of Suki Chongbian, who is the head of HR of 3M Global Services Center. And so I actually asked Suki if she can share a bit about what has been happening in 3M after all the initiatives that they have done, and also, any encounters regarding migraine, especially that most of their workforce are working from home. So hi, Suki. So hope you can hear us and say hello to everybody. She is
Hello?
Hello. Hi, Suki.
Yes. Hi there.
Hi.
Sorry about that. I'm calling on my mobile.
No problem.
But yes, very happy to be here today and, very good talk. Thank you. Could you repeat the question, Gladys?
Yes, no problem. So my question is, how have you guys been in 3M after all the initiatives that you have done for your employees? And have you also heard any issues on migraine, in the course of the quarantines that we've had for the past 3 months? So a little bit of sharing.
Yes, yes. So,
Mhm.
how it's been so far, it's been over 3 months, right, of quarantine, and
Mhm.
100% of our workforce has been working from home. Luckily enough, we're people are healthy, no confirmed cases, and
That's
additionally,
good.
the activities that our employees have been engaging in, both on the regular work side in terms of productivity, as well as also in terms of engagement activities. They've been very, what's the word? They've been very happy, with it. We're very proud, actually, even with our return to workplace initiatives, making sure that people are ready. Even if we're not planning to do that for the next several months, we're seeing posts on Facebook. Our general manager is receiving emails and messages as well and the management team is receiving messages from employees about how happy they have been, with the way that 3M has been supporting them and their families, even during this time of quarantine. Now, as it relates to migraine or mental wellness, there are, as you said, opportunities, as we shared earlier, opportunities for our employees and their dependents to avail of the services, counseling, access to resources. Um, Specific to migraines, there are none that have been reported that are repeated, but we do have cases in the organization where people experience migraines, specifically for myself, for example, and my team. And the way that it's managed really is through the appropriate rest and balance, and obviously understanding their cycle. What causes it? How do they avoid it? And how do they manage it at this point? So I think this information shared at the call earlier will be beneficial to them. So I'm glad to see it's been recorded. Thank you,
Yes, thank you
Gladys.
so yes, thank you so much, Suki, for sharing what has been happening in 3M and what are the initiatives that you are doing, especially on the way forward. Okay, so we have one question from an anonymous attendee. Curious about the quick TV sessions, if okay to share. This is actually one of the initiatives from the case study. So maybe Tony can provide more insights and enlightenment on this.
I think the TV session was done by Ingram Micro, if I'm not mistaken.
Mm-mm.
Yeah, maybe you can invite Michi. Gladys, right?
Yes,
Michi's in the call.
yes,
Yeah.
Michi is on the call. So we'd like to acknowledge the presence of Michael Mariano, who is the Employee Engagement Manager of Ingram Micro. So give us a call. There, I see Michael. I see Michael Mariano, aka Michi. So Michi, feel free to
Okay.
share about Quick TV.
Oh, sorry, can you hear me, guys? Hello, everyone.
Yes, we can. Hello.
Well, sorry. Actually, I went through the presentation earlier. The quick TV, I think, is not from Ingram. I think it's from is it from SNP?
Actually, I think it might be from 3M.
Yes,
From
it is
3M.
3M.
Yes.
Yeah, it is.
Sorry.
Yeah. So I guess quickly sharing about Quick TV for 3M, we utilize MS Teams, and part of one of the features there is when you could do a Quick TV live session, um, where employees up to, I think, 750 people can call into the session, and it's actually curated to cover specific topics that people are interested in. So the quick TV sessions are scheduled weekly and are managed by what we call a 3M Club group, who has been a very great, engaging team of people. The topics that they cover are varied. At one point in time, we talked. Our legal counsel came in to talk about COVID and regulations and answer questions from employees. Another time it was, special features of employees who, in terms of like what their activities were outside of work, to engage other people and encourage them to practice total well-being. So the quick TV sessions are popular, and that's really how we engage our employees. And we can also track, the feedback that we get and the questions that we get. So we're able to get back to people as well after. So that's a quick sharing on quick TV.
Okay, thank you so much, Suki, for sharing more insights and information about quick TV sessions. Given that Michael Mariano, or Michi for short, has introduced himself briefly and all that, maybe I'd like to ask Michi, to share something about Ingram Micro, given the initiatives that you have done in place, especially in times like this. How have you been, especially when it comes to mental health and wellness? And, have you encountered any situations on migraine by your employees? Yeah. So, Michi, take it away.
Okay. Hi, everyone. So specifically on migraine, I think I won't be able to share enough information on that. But for mental health in general, we've been actually pushing on this. And since the lockdown was announced in March, we had a couple of pulse surveys also launched on a monthly basis, just simply to monitor not just our executions for our new work at home setup, but also how are the mental health situation of our associates. And clearly, actually, and I think this is not just for Ingram Micro, but majority of the employees really do feel the heightened anxiety and worries due to the pandemic. And it's not just because of the response of the organization, but mostly they look at it on the situation on how the government is responding or how the things are escalating. And of course, being exposed and having too much coverage on all of these can really have an impact on the mental health of the associates. And so with that, we launched several campaigns and programs specifically for mental health. While we did try to create some semblance of normalcy through our fun at home engagement activities, we did focus on launching also some virtual webinars on mental health, how to create a work-life harmony even at home, and make sure that they also prioritize their mental health in this time of pandemic. We also created a few other channels specific on this. We used majority of the channels that we have: social media, email, website, and also we did have some contributions from our associates who shared how they are specifically coping on this pandemic, either by having either by showcasing how they manage work and dealing with family concerns, or them showcasing how to live with mental health concerns or problems or challenges in this time of pandemic. So there are actually some brave and courageous associates who really shared their stories just to inspire also the other employees who are feeling down because of being cooped up at home. Apart from that, like what we also emphasized in our human capital strategy, it doesn't mean that we're in lockdown and we're cooped up at home and we're not working at the office. Is that we're not going to do what we used to do before in terms of the human capital programs. And so what we did is just really re-energize our human capital strategy and adapt into the next normal, where we're really fully utilizing the digital and converting all of the programs that we have into something that we can do in a virtual setup, in a virtual environment.
Okay. Thank you so much, Michi, for your sharing about Ingram Micro in terms of dealing with mental health initiatives. And I like what you used on work-life harmony at home. I think this is very much relevant to all of us. Anyway, there is a question here, and here it goes. What is the best way to show care for employees who are redeployed or floating or about to be out of jobs? Maybe if we can ask Dr. Gia to provide her insights about this.
Okay, so number one is, again, I'd always go back to communication. So if there are already plans of possible layoff, I think having to communicate the plans earlier, at least at a minimum 30 days, just so the employee can look for another job. That's going to be, uh, that's the proper way to go. Because the least that we need right now is our questions about our employment, the path forward, most especially that COVID is here to stay again for quite some time until after the vaccine is produced. So clarity in communication is really important. But as much as possible, before terminating, job redesigning can be an option. Meaning to say, if the worker's skills can match a certain department, then the employer might want to accommodate that employee to another department, something like that. Exhaust all means before really terminating at humanitarian way of terminating. That's my take on that.
Sorry. Thank you so much, Doc Gia, for providing your answers about that and your take about this question. There is another question about migraine, to be specific. So here it goes. And I think Dr. Martha will be the best. Well, Dr. Martha is the best person to answer this question. So here it goes. How can we know who among our employees have migraine and understand the impact of this disease to their work?
Okay, thank you for that question. I would presume that you have a company doctor, or at least you would refer your employees who get sick to a certain health facility. So any doctor actually can diagnose migraine. So if you would refer these patients who have very frequent and constant headaches to any doctor, then that doctor could say if this patient has migraine or tension type headache or other types of headache, or if there is a pressing problem like it's a secondary headache, probably the patient has tumor or aneurysm. The doctor could also diagnose this and probably ask for diagnostic tests like the CT scan or MRI to rule out these other problems. So how would you know the impact of this disease, no? Especially in her work output? If the HR could probably tally how many times she would complain of headaches, or how frequent is this person absent from work, or you can also gauge this with her productivity. For example, he cannot finish the task that he's supposed to do, especially during deadlines, then you would know that there's really a problem, whether it's a physical or other emotional or social problem. So, of course, as what we have been saying earlier, there should be a very good employer-employee relationship. You should really know your employees very well so that you would know if they are just faking probably, or they really have a specific illness, no? And you can also monitor if these attacks occur when the patient had overtime or there were extra extensions of work, like you have to ask them to attend certain social functions in the evening, which can also impair their sleep pattern, or does the patient have these attacks when he is in the graveyard shift, then you can identify these trigger factors which is causing the patient's attacks. Then probably you can adjust this work schedule to avoid this patient having frequent migraine attacks. I hope I was able to answer your question.
Yes, I think you have hit it spot on. Okay, so Paula Chavez wants to ask her question verbally. So with that, may we call on Miss Paula Chavez to raise your question. Hello, there.
Hi, Gladys.
Hello.
Hi. I think the questions have been asked. All the questions that I had earlier have been asked. So I think I'm good for now. Thank you.
Okay, thank you. Thanks, Paula, for that. Okay, so while waiting for any questions from the audience, so okay, I have another question from an anonymous attendee. What sample KPIs are used by companies who seriously promote trust, pride, and enjoyment in work? Is there a ranking of companies or organizations of being great places to work? So I think Tony can answer this question. So Tony?
Yes, thanks, Gladys.
You're welcome.
Okay, so I shared earlier the dimensions of great workplaces. If you remember, credibility, respect, fairness, pride, and camaraderie. Those are the main KPIs that great workplaces have, and that those are the main metrics that we use to evaluate whether an organization is a great workplace. So of course, there are many aspects, many sub-dimensions, that's what we call, under each of those 5 dimensions that we've shared. And like what I've said earlier, when it comes to respecting your employees, it's all about supporting them, giving them the tools and resources that they need, collaborating with your employees, making them feel that that their voice matters, hearing them out. And it's also about caring for your employees as an individual and not just as an employee. So this means if they need to take time off to attend to personal matters, even though they're working from home, we are understanding of this. So again, it's credibility, respect, fairness, pride, and camaraderie. Those are the main metrics that we look into. And in totality, it's really about the level of trust in the organization. And yes, we do have a second question, I think, is there a ranking of companies, organizations in terms of being great workplaces? So organizations who go through this rigorous process, we do a survey. We survey their employees. So we believe at Great Place to Work that it's really the voice of the employees that can tell whether an organization is a great workplace. So it's not just simple balloting or simple write-up about an organization, but it's the actual day-to-day experience that employees have. And from there, we also evaluate them looking into their people practices. This is very important. So just recently, a month ago, yes, we did announce the top 5. So there is a ranking, the top 5 best workplaces in the Philippines, wherein, as I've mentioned earlier, Ingram Micro is one of them. I hope I answered the question. Let me know if there's a follow-up question.
Yes. the question has been answered. Thank you so much, Tony. Okay, another question for Doc Martha, and here it goes. Do we have a way of measuring the impact of migraine in the workplace?
Um, if we really want to have an objective measure, probably this would depend on the patient's productivity in terms of absenteeism. If the patient have, if the person or employee has frequent absences, or even if the patient is reporting to work, but his productivity is low, he cannot finish the tasks that are given to him, or he has to pass this on to somebody else. I think that's how you can measure the indirect costs, as was presented in one of the studies. And if you would measure the direct cost of migraine, then this would relate to their medical expenses. So probably if you have if you have HMOs in the companies, then you would see that these are the employees who are frequently using their medical health benefits in terms of diagnostic tests like CT or MRI, or do you also provide free medications in their health packages? Then all of this would add up to the direct cost of the illness. Thank you.
Thank you so much, Doc Martha, for this. We have one last question wherein this will be addressed by either Doc Gia and Tony about this. So here it goes. So how can leaders balance transparency but not oversharing in a sense that it might cause panic to employees? So really is being transparent and honest in communication but not causing unnecessary panic or anxiety to employees.
Okay, my take on that is that at a certain extent, especially if the business plans to close down, before closing the business, there has to be a plan for at least the employee to thrive for a minimum of 6 months at least. Number two, transparency really is two-way. Panic and anxiety will really happen, especially if the livelihood is affected. But at this point, I think a hopeful type of transparency is needed. There's no other way but to be honest about the situation, because out of everyone, it's the employer that should know the path. So I think just go straight to the point, and I think that's better. And realize that anxiety and panic may happen, but yeah, that's my take on that.
Yeah,
Thank
I
you
agree
so
with
much.
I agree with Doc Gia. Transparency is really like non-negotiable, but it is tough. Like you can be very transparent, but employees have different ways, you know, as individuals, we have different ways of accepting the message. Like others may take it lightly, some may take it too seriously, and those are totally beyond our control as you know, leaders in the organization or as managers. I think we as leaders and as HR leaders, it is very important that we are attuned to the dynamics of the organization. So, you know, like, is our organization, is our team one wherein employees are able to take that candid feedback, very open feedback? Or is there a certain group of employees who are very anxious and we are concerned about how they will take it on? So depending on that dynamics, I would say if you think that they can take it lightly, and if you think that trust has been established, you've invested a lot to establish the trust long before COVID happened, then take it on, open it, do a town hall, have an open discussion. But if you feel that there's that certain group of employees, and admittedly you feel like you haven't really established that level of trust, then take it on a one-on-one level. Have that private conversation with your employees so that you're able to support them and not put certain people on the spot. So yeah, That's my
Okay,
take.
thank you so much, Tony and Doc G, about this. Okay, there is actually one catch-up question or pahabol regarding migraine. So again, this is for Doc Martha. So the question is, you mentioned that screen time is a common trigger for migraine. Can both doctors, so Doc Gia can also answer this, suggest on ways how employees can prevent migraine but still be able to work from home?
Okay, so we know that most of the employees would use the computer, as part of their work. Probably if we can lessen screen time, are there any other tasks that they can do without the computer that would be very helpful so that they can have some kind of deviation and they wouldn't be looking at the screen 8 hours a day, except for some breaks, and probably some physical changes that we can implement would be the lighting in the office should not be that bright. Aside from the light that is presenting from the screen, the fluorescent light can also be another trigger. You can provide anti-glare filters for computer monitors and provide a liquid crystal display monitor. So all of this can lessen the trigger even if they have to be in front of the computer most of the time.
Okay. Thanks, Doc Martha. Doc Gia, maybe you'd like to add?
Yeah, screen time is very important. So I'd always advise individuals in a work from home setup to take micro breaks in between and avoid or adjust the brightness of the computer panel as well. And when you take those micro breaks, it would also help if you look at something that's neutral, because it relaxes. Somehow it has a relaxing effect. And do something else. No, again, when you make a routine aside from computer work, it's important that you inject self-care activities in between. And when I say self-care, exercise, you might want to eat snacks or something that would make you feel good and something that would help you cope with the overwhelming task every day. And we have to remember that we can't be 101% productive, especially nowadays when there's another challenge that we're facing, which is COVID. So let's turn it around, and it's a shift in perspective in terms of we're working from home and doing the best that we can with what we have. I think that's a good jump start whenever we start to slide into that thinking that I have to be extra productive because I'm at home. So I think we should already shift in terms of that.
Okay, thank you so much, Doc Gia, for your insights about this. So anyway, to push for this call to action, we would like to acknowledge Ms. Christine Fajardo, the Country Public Affairs and Corporate Responsibility Head for Novartis and Sandoz in the Philippines. To share more about Christine or Chris, she concurrently heads patient advocacy for Novartis Asia
No, no
Cluster
need.
and okay. So, okay, so with that, I shall jump into, ladies and gentlemen, Miss Christine Fajardo.
Yeah, that's that. Thank you so much, Gladys. Really, really nice discussion, very good discussion. And thank you so much to our speakers, Ms. Antoniette Talosig, Dr. G. Sison, Dr. Martha Bolaños, for sharing your expert insights on promoting mental health in the workplace and easing the burden of migraine among employees. Now, if you can show my slide. Yes, great. Thank you so much. Our expert resource persons have highlighted how migraine reduces workplace productivity through absenteeism or missed work, and presenteeism or decreased productivity while at work. Unfortunately, many employees with migraine lack support and are often stigmatized and are not able to work, thus increasing work-related anxiety and discrimination. All these can impact mental health. This is the reason why Novartis collaborated with patient groups and leading experts in neurology, telemedicine, and digital medicine to pilot our Migraine Care program. Migraine Care aims to help Novartis associates living with migraine to improve their quality of life. The comprehensive program is endorsed by the Swiss Headache Society. Now with this program, 339 Novartis employees registered to the program, out of which 141 consented to their data being analyzed and 79 completed the program at 6 months. Participants received monthly sessions of individualized telecoaching comprised of educational modules, action plans from a specialized nurse by phone with MedGate, and through a specially developed module on the Migraine Buddy smartphone application as mentioned by Dr. Lu-Bolaños. Next slide. At the end of 6 months, participants reported 54% decrease in migraine-related disability and a 9% increase in the patient activation measure, a measure which assesses patient knowledge, skill, and confidence for self-management. Loss of productivity through both absenteeism and presenteeism were reduced by more than 50%. And in addition, participants report their private life being significantly less impaired by migraine. I would like to underscore this quote from Dr. Andreas Ganterbing, president of the Swiss Headache Society, that the study confirms the high burden of people living and working with migraine, but also demonstrates that empowering individuals can significantly increase quality of life and productivity. This further emphasizes the notion that employer-led well-being programs can benefit individuals, companies, and society as a whole. On this note, Novartis is exploring opportunities to work with other employers who are interested in supporting their employees and family members living with migraine through the Migraine Care program. We look forward to partnering with HR leaders to provide migraine education and facilitate support mechanisms for migraine sufferers in the workplaces. Thank you very much for joining the PATHw Perspectives webinar series, which Novartis is organizing in partnership with Great Place to Work, the Global Authority on Workplace Culture. We hope that you can join our next webinar, and stay safe and well, everyone. Thanks a lot.
Thank you so much, Christine, for that. Okay, thank you so much, Christine, for that. And once again, thank you to all the speakers and attendees for their time to be part of this auspicious event. So, reminder to fill the post-survey event survey so that at least we'll know the strengths that we have and the areas for development on how to further improve on our next webinar series. So with that, once again, my name is Gladys Santiago-Zafra from Great Place to Work and your moderator for this afternoon. Good night and stay safe. Bye-bye.